joint, the condyle. Can you guys see that? So there, and then over the mandibular molars. And I'm going to palpate at the joint line and in the angle of the mandible. I'm going to distract, so I'm pulling inferiorly and slightly anteriorly. It's almost like a J. So just straight down is distraction. Okay, distraction with translation is with the J. Okay, so down and then a little bit inferior. So it's almost like a J. Taking the mandible and pulling it that way. Okay, everybody good with that? The next one is a lateral glide. So in order to take the joint and move it laterally, I'm going to have to be on the medial aspect of the mandibular molars. So I'm basically here on the other side. So my thumb is on the medial aspect of the molars. I'm palpating here. I'm holding on to the mandible. Okay. And I'm basically going to push with my thumb to create a lateral glide. Not that hard, okay? Just rotating and take you get the idea. So here, and then pushing lateral. Okay? And I'll show this on a real person, but I think it's actually easier to see on this guy the first time. Okay? Because you really don't see much when I have everything else. The medial glide is now my pressure point. In the last one, the lateral glide, my contact was with my thumb at the molars. My contact is now going to be my index finger, the tip of the index, and it's going to push the joint medially. Okay, so I'm going to put my thumb at the middle of the incisors, and my index, second digit, is going to do the medial directed glide. Okay, so basically I'm just doing this type of motion. Okay, I have to distract a little bit, okay, to get into the teeth. All right, and then I'm just doing a medial glide. So I'm going to assess joint mobility to see if it's normal for all of those. So can I borrow you, Kevin?
Push it down. Push it down.
I explain to the patient what I'm doing. I put the tongue depressor over the teeth. Okay. These are sharp. Let me know. The hardest thing about that is this testing is to get the tongue depressor so that it's comfortable for the patient. Okay. You don't want to be gouging it into their cheek. Okay. That makes it really uncomfortable, and you get a false positive because they guard against you. It hurts. All right. I tell the patient I'm going to be putting my hands in your mouth and just gently testing the joint motion, okay, to see if it's stiff or if it's moving too much. Because my hands are in your mouth, you may not feel comfortable to talk, but if you want me to stop at any time, raise your hand. Okay, so lift your hand so that way they feel comfortable with that. And so the first thing I'm going to do is I'm going to place tongue depressor. And I want you to feel if this is comfortable where I'm putting it. Is that okay? You're not going to close your mouth just a little bit. That's still okay? Okay, now open it up a little bit more just so I can get my thumb in there. Okay. Now I want you just to relax your mouth. Okay, just close it. You won't bite you. Just relax it. There you go. And because if he's holding it open, you're not going to be able to assess the joint motion. So I'm here and I'm doing an inferior glide with a little bit of distraction. Okay, so I'm going inferior and now doing a little bit of a J. So an inferior glide to get some distraction and translation. Okay? So he is not moving real well at that side. Okay. Getting a little motion, but not really well. And I'm going to compare left to right to see if that's normal or not. For the sake of time, I'm not going to today, but see if it's normal. The lateral glide, I'm going to come on, open your mouth again for me, inside of the molars. Is that comfortable position? Okay, relax. And then I'm just gonna, again, with my thumb is the pressure point, and I'm pushing out, okay? And I'm just doing a lateral glide, and you should feel the condyle separate. I'm feeling through this hand, and I'm also palpating the condyle here. I feel motion, okay? You can feel that. All right, so that was lateral glide. Medial glide, my pressure point is at the tip of the index finger. Okay, open your mouth just slightly. Thumb is in the middle of the mandibular incisors. Contact here. Now relax your mouth. Close it. There you go. And then I'm just using my index and my whole hand to do this, to do a medial glide. Okay? All right. So then I compare right to left. Were any of those uncomfortable? Okay. Did you have any pain at all with the stress?
No, I just felt like I was kind of guarded.
Okay, so he didn't feel completely relaxed with it. Okay, so that's something else you can pick up. That's one of the reasons I like to palpate here, and you saw my hands all across here so that you can feel for guarding as well. Limited motion. Questions? Comments? Yes.
Of any of the disorders you covered, are there any like you take caution with doing like any of the modes and
If I am suspicious that someone is dislocating and very hypermobile, I'm careful about my accessory motion testing in terms of just doing it very slowly. There would be, in terms of contraindication, if someone has a tendency towards hypermobility, I wouldn't do manipulation as a treatment. But I'm still careful if it's someone who has a history of dislocation, I'm very careful to go very slowly with my accessory motion testing. But I can't think of any other situations. All right, grab some gloves. I want you to practice those on each other when you're walking around.